Joe and Abid talking to you about the events of this week, largely healthcare focused. So we had a throne speech from the government on Monday, a pharmacare OHIP Plus announcement on Tuesday. On Wednesday, we saw the Premier and her government make the single largest investment in mental health care ever. I think it's 4 years, $2.1 billion. Just for context, Abid, before I ask you to talk about what's in it, when the People's Guarantee came out in November of 2017, the PC party had indicated the, up until then, largest investment in mental health care in our province's history. That was 10 years, $1.9 billion. So I imagine that as soon as that came out, people at the Ministry of Health set about busily to try to outdo that. And now we're talking 4 years, $2.1 billion. That's a lot of money.
Absolutely, and this is an issue that cuts across all party lines. There is a tremendous amount of support. One can only needs to look at the Bell Let's Talk campaign in January to see the degree of support. The last federal election, Justin Trudeau made home care and mental health care two key priorities with respect to federal funding for health care. So this continues along those lines, and I think that what this also talks about is this notion of expansion of Medicare in many ways. When they first conceived of Medicare, the way it was kind of deployed, we really focused on the body and the physical health as opposed to mental health. So the idea of expanding more into mental health, and that includes some areas that were not covered before, such as psychotherapy, such as cognitive behavioral therapy. This particular announcement actually extends those particular services, not maybe universally, but to another 350,000 people over the next 4 years, which is the beginnings of something very significant. Right now, for example, psychologists are not funded, but psychiatrists are. Or if you receive care within the hospital, you're funded for mental health care, but in the community, it's not really covered. So I think that unless you go visit your primary care doctor, and in many cases, they are not connected to some of the local programs that are funded by the government, and to be able to provide that service to their patients. So I think this is a way for the Liberals to really push forward on an area that all parties have been weak on over the past many years, and really to demonstrate to Ontarians that on a key subset of the healthcare concern or the issue, that they intend to invest a significant amount on that.
Well, and there's a lot here. I mean, and you're right. If there were two kind of big gaping holes in our system of Medicare, it was drugs, which is slowly being covered. So now in Ontario, we have 2 million people over 65, 4 million people under 25, so we have 6 million people having their prescriptions covered by the provincial government. Certainly mental health was a big gaping hole. There are others. I mean, there's vision care. There are other things that are still not covered completely by Medicare, but I think this is good news. We'd all agree that 12,000 more young people having community-based care, such as counseling. Every high school is going to have an additional mental health worker. 15 more youth wellness hubs, up to 350,000 people with mild to moderate anxiety and depression will be able to get treatment and have it covered. I mean, the list goes on. There are housing units, supportive housing units
Absolutely.
being built. I think we'll probably see some of this money dedicated to addictions. We continue to have an opioid problem in
Absolutely.
North America. So good news. Now, it was announced at CAMH, the Center for Addiction and Mental Health, but it's not completely hospital-based, this mental health funding. It's in the community, it's in professionals' offices, and it appears to be, it might even be where people live. So this is a good one, and that was Wednesday.
Right.
So
It's interesting to see how Doug Ford, when they do come out with their U platform, how they respond, whether or not they will make healthcare a significant plank, part of their overall platform, or whether or not they will say, these announcements, Kathleen Wynne is simply writing checks. that these are things that we can't afford. We can't afford this increase in expansion into Medicare. We can't afford all these different expenditures. So it'll be interesting to see where he lands on this. On mental health, I think that everybody can agree that more needs to be invested, but it's all a question of degree.